This is All India Radio. We now bring you a special news program on COVID-19. Good morning. I am Lalema Aneja Dang and with me is Subhadra Ramachandran. The headlines. Centre offers all help to Andhra Pradesh to tackle situation arising out of Visakhapatnam gas leak. Home Ministry issues advisory in the wake of the incident. Health Minister Harshvardhan says no corona positive case reported from 13 states and union territories during the past 24 hours. 2 Air India flights bring back over 360 Indian expatriates from the UAE. Health Ministry issues guidelines for quarantine at private hotels, service apartments and lodges. And about 200 Shramik special trains ferry nearly 2 lakh stranded migrant workers and students back home. Centre has offered all help to Andhra Pradesh to tackle situation arising out of Visakhapatnam gas leak. Prime Minister Narendra Modi and Home Minister Amit Shah spoke to Andhra Pradesh Chief Minister Y.S. Jagan Mohan Reddy yesterday and assured him of all required aid and assistance from the centre. Prime Minister chaired a high-level meeting yesterday to take stock of the situation and steps being taken in response to the gas leak incident. Mr. Modi discussed measures being taken for the safety of the affected people. The death toll in Visakhapatnam gas leak has risen to 11. The styrene gas had leaked during wee hours yesterday from a polymer plant at R.R. Venkatapuram village near Visakhapatnam and quickly spread to the villages in a 5-kilometer radius. 246 people with health complications are undergoing treatment at King George Hospital. About 800 people in R.R. Venkatapuram village in Gopalapatnam were evacuated and most needed only first aid. Cabinet Secretary Rajiv Gauba also reviewed the situation with the secretaries of the Ministries of Home Affairs, Environment, Chemicals and Petrochemicals, Pharmaceuticals, Information and Broadcasting, members of the National Disaster Management Authority and Director General National Disaster Response Force and others. Briefing media persons in New Delhi, NDMA member Kamal Kishore said that the NDRF team was deployed immediately to support the state government and local administration.
CBRN teams of NDRF are deployed very quickly to support the local government as well as the state government. They have assisted with the evacuation of communities in the immediate vicinity. The central government is mobilizing specialized CBRN teams from Pune, where we have the core capacity on CBRN of NDRF located.
Andhra Pradesh Chief Minister has ordered a probe into the matter. State Industries Minister Mekapati Gautam Reddy said the LG Polymers unit was supposed to reopen post-lockdown on Thursday. The Union Home Ministry has issued an advisory for the general public about the things to be done and not to be done following the gas leak incident in Visakhapatnam. The ministry gave a detailed account about the chemical which was leaked at the factory. According to the advisory, styrene is a colorless, flammable liquid which is used to prepare polystyrene plastics, rubber and fiberglass. Common symptoms of styrene exposure include irritation to the eyes, nose and skin, gastrointestinal and respiratory effects. Its long-term exposure may cause central nervous system and kidney-related problems, depression and headache. The advisory said if someone accidentally swallows styrene, give large quantities of water and do not induce vomiting. In case of contact with styrene, immediately flush eyes or skin with plenty of water for at least 15 minutes while removing contaminated clothing and shoes.
Health Minister Harshvardhan has said that 13 states and union territories have not reported any new case of COVID-19 during the past 24 hours. These include Arunachal Pradesh, Chhattisgarh, Goa, Jharkhand, Himachal Pradesh, Jammu and Kashmir, Ladakh, Kerala and Odisha. Daman and Diu, Sikkim, Nagaland and Lakshadweep have not reported a single case till date. Dr. Harshvardhan yesterday reviewed the preparedness and containment measures for the management of COVID-19 in Uttar Pradesh, Odisha and West Bengal. The Health Minister said, as on date, there are 180 districts with no new cases in less than 7 days, 180 districts with no new cases in 7 to 13 days, 164 districts which have not had any new case in 14 to 20 days, and 136 districts with no new cases since the last 21 to 28 days. Informing that 3,561 new confirmed cases have been reported in the country in the last 24 hours, Dr. Harshvardhan asserted that in comparison to other countries, India is in a better condition as the fatality rate is 3.3% and recovery rate is 28.83%. A total of 448 new confirmed cases of novel coronavirus have been reported in Delhi during the last 24 hours, taking the total number of cases to 5,980. Delhi government has confirmed that 1,931 patients have been cured and discharged so far, and 66 deaths have been reported in the national capital. In Rajasthan, the number of corona active cases is 1,439, while 1,889 people have been cured from the infection. So far, 99 people have died due to infection in the state. Corona cases infection have been reported in 31 out of 33 districts of the state. Meanwhile, life in rural areas of Rajasthan is slowly returning to normal. More from our correspondent.
More than 17 lakh people of the state are getting job in MG Manrega work, and it is to reach up to 30 lakh in the coming days. Around 36 crore rupees are being spent every day on workers getting jobs in MG Manrega work. Commissioner MG Manrega PC Kishan told that especially water conservation works and works of personal benefit are being carried out to ensure social distancing.
ग्रुप में काम नहीं दिया जाता है, अभी इंडिविजुअल को काम दिया जाता है, और इंडिविजुअल सोचिए एक जगह में जो काम दिया गया एक ही साथ में 15 दिन का काम दे दिया जाता है, ताकि दो मजदूर का बीच में जो दूरी है सभी टाइम 2 मीटर से ज्यादा रहता है। उसके बाद कार्य सबको ऐसे चयन किया जाता है कि बड़े बड़े काम है जहां 20-25 मजदूरों को पूरा फैला दे सकते हैं।
जितेंद्र द्विवेदी, AIR न्यूज, जयपुर।
In Gujarat, the number of COVID-19 cases crossed 7,000 after 388 fresh cases were reported from 12 different districts yesterday. Death toll in the state also increased to 425 after 29 more patients succumbed to COVID-19 yesterday. State Health Department said out of the 388 new cases, Ahmedabad alone recorded 275 more positive cases and 23 deaths. Ahmedabad recorded 4,991 cases so far. Here's a report from our correspondent.
Out of the total number of cases, maximum cases have been reported from Ahmedabad and Surat. Chief Minister Vijay Rupani held talks with the chairman of more than 100 residential societies located in Old Ahmedabad through video conferencing yesterday. He urged them to support the battle against COVID-19. Ahmedabad city administration converted around 60 hotels into COVID care centers, while 8 more private hospitals were declared as COVID-19 hospitals. After Ahmedabad, Surat Municipal Corporation has also declared the closure of shops selling vegetables and fruits from tomorrow for a week. Meanwhile, 25 labourers who had gone to Odisha from Surat were tested positive, following which all the trains going to Odisha from the state have been cancelled. Labourers will be sent only after testing their samples for COVID-19. Aparna Khun, AIR News, Ahmedabad.
77 inmates and 26 police tests positive. 77 inmates and 26 police personnel have tested positive for COVID-19 in Mumbai's Arthur Road prison. This was informed by Home Minister Anil Deshmukh. Maharashtra jail authorities have said that all positive inmates will be shifted to GT Hospital and St. George Hospital in guarded vehicles tomorrow morning, while staff members will be shifted separately. In Telangana, 15 more people tested positive for coronavirus, taking the total COVID-19 cases to 1,122. Out of the 15 fresh cases, 12 are from Hyderabad and surrounding areas, while 3 are migrants. Currently, 400 patients are undergoing treatment at the hospital. Meanwhile, 22 out of 33 districts in the state have not reported single coronavirus positive case for the past 14 days.
In Tamil Nadu, the retirement age of the government staff, teachers and those in public sector units has been raised by a year to 59. The order comes in the wake of reports of loss of revenue due to the pandemic. Meanwhile, the state has witnessed 580 new COVID-19 cases yesterday, taking the total to 5,409, out of which the active case load is 3,822. Meanwhile, arrival of flights from other countries bringing Indians back home via Chennai begins today. More from our correspondent.
This morning, 2 flights from Dubai are set to touch down at Chennai airport, bringing in 400 returnees. A total of 11 aircraft are scheduled to reach Chennai and Trichy in Tamil Nadu from various places in the Gulf, the US, the UK, the Philippines and Singapore over a period of 6 days till next Wednesday. The state government has formed a 9-member team of officials led by Housing Secretary Rajesh Lakhani to coordinate their travel. The returnees will be subjected to screening on arrival, followed by quarantine near the airports as per the Union government guidelines, after which they will be facilitated to go back home. Jai Singh, AIR News, Chennai.
Uttar Pradesh government has suspended a majority of labour laws in the state for 3 years with a view to attract investment and to help both existing and new industrial units. The state government has also decided to establish Japanese help desk to attract the investment from Japanese companies and help them in starting their business in Uttar Pradesh. In an attempt to make Uttar Pradesh a favourite destination for investors, State Cabinet recently finalized the freezing of major laws in favor of industry for 1,000 days. More from our correspondent.
In an attempt to make Uttar Pradesh favorite destination for investors, the state government brought ordinance for temporarily freezing of major labour laws in favour of industry for 1,000 days. After this amendment in labour law, State MSME and Export Promotion Minister Siddharth Raj Singh yesterday interacted with Japanese Ambassador to India, Satoshi Suzuki, through video conferencing and said that Uttar Pradesh has enough land and skilled labour for starting any business. He said that a Japanese help desk will be set up in the state to assist entrepreneurs from that country. During the interaction, Suzuki evinced keen interest in sectors like electronics, food processing, industrial parks, pharmaceutical, medical equipment, automobile, and said that he will ensure interaction between UP government and major Japanese companies. Suzuki said that Japanese government has created $2.2 billion fund to help companies migrating from China. Sushil Chandra Tiwari, AIR News, Lucknow.
2 special Air India flights carrying over 360 stranded Indian nationals from the United Arab Emirates, UAE, landed in Kerala last night. The flights were a part of India's massive exercise named as Vande Bharat mission to bring back its citizens stuck in different parts of the world in the wake of COVID-19 pandemic. Nearly 15,000 Indians stranded overseas are expected to return on special Air India flights from 12 countries over a week. Our correspondent reports that the first flight from Abu Dhabi landed at Kochi International Airport, while the second flight from Dubai landed at Kozhikode Airport.
Flight carrying 181 passengers from Abu Dhabi arrived in Kochi at 10 p.m. yesterday. Passengers included 49 pregnant women and 4 kids. Flight from Dubai carrying 182 passengers, including 5 kids, landed in Kozhikode Airport at 11 last night. After detailed medical checkup, 3 people were sent for isolation in hospital in Kochi and 5 people were moved to hospital in Kozhikode. Over 80 people were permitted for home quarantine and others were taken to the state COVID care centers in specially arranged buses and taxis. Authorities informed that all necessary arrangements are done to ensure strict quarantine of the returnees and medical checkup after a week. Mayusha for AIR News from Thiruvananthapuram.
Our West Asia correspondent reports about the special flights being operated today to bring back stranded Indian expatriates from Gulf countries.
On the second day of the Vande Bharat mission, countries in the Gulf are preparing to repatriate nearly 650 distressed Indians. Around 350 Indians will be flying back from Dubai to Chennai on 2 flights. Riyadh will send 155 people to Kozhikode and Bahrain will also send more than 150 people back to Kochi. Priority is being given to workers in distress, elderly people, urgent medical cases, pregnant women, and others stranded in difficult situations. Strict health protocols will be followed by the Indian missions in Dubai, Saudi Arabia and Bahrain before the shortlisted passengers are allowed to board the flight for India. Kanchan Prasad, AIR News, Dubai.
Union Health Ministry has issued additional guidelines for quarantine of returnees from abroad, contacts and isolation of suspect or confirmed cases in private facilities like hotels, service apartments and lodges. The guidelines came as there are a large number of facilities such as hotels, service apartments and lodges which remain unoccupied due to the impact of COVID-19 on travel and tourism, and people who don't have requisite space at home may opt for such facilities. This is likely to reduce the pressure on the family, give comfort to the person and protect the family members and immediate neighborhood. As per the guidelines, the quarantine and isolation facility will not coexist, and the facility owner will have a choice to dedicate the facility for either of the two. These facilities will offer single room on paid basis with attached washrooms, and the tariff for the accommodation and services will be fixed by the facility in consultation with the state government. The facility owner of the quarantine and isolation facility will ensure in-house availability of a trained doctor and a nurse on 24/7 basis, and the doctor will monitor the contacts and cases once a day.
This is All India Radio bringing you a special news program on COVID-19. Let's take a look at the headlines once again. Centre offers all help to Andhra Pradesh to tackle situation arising out of Visakhapatnam gas leak. Home Ministry issues advisory in the wake of the incident. Health Minister Harshvardhan says no corona positive case reported from 13 states and union territories during the past 24 hours. 2 Air India flights bring back over 360 Indian expatriates from UAE. Health Ministry issues guidelines for quarantine at private hotels, service apartments and lodges. And about 200 Shramik special trains ferry nearly 2 lakh stranded migrant workers and students back home. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Ministry of Railways has converted 5,231 of its coaches as COVID care centres. These coaches can be used for very mild cases that can be clinically assigned to the COVID care centres as per guidelines issued by the Health Ministry. These coaches can be used in areas where state has exhausted the facilities and needs to augment capacities for isolation of both suspected and confirmed COVID cases. Here's a report.
A total of 215 stations have been identified for placement of COVID care centres. Out of these 215 stations, Railways will provide healthcare facilities in 85 stations. In rest of the 130 stations, states will request COVID care coaches only if they are willing to provide staff and essential medicines. Indian Railways will take care of water, electricity, repairs, catering and security of COVID care centres. Besides, Indian Railways will deploy more than 2,500 doctors and 35,000 paramedic staff to meet the COVID-19 challenge. Around 5,000 beds in 17 dedicated hospitals and 33 hospital blocks in railway hospitals have been identified for treatment of COVID-19 patients. As per guidelines of Health Ministry, state governments would send the requisition to Railways, and Railways will make allocation of these coaches to the states and union territories. With Dipendra, Suparna Saikya, AIR News, Delhi.
At least 14 workers were killed in a railway accident in Aurangabad early this morning. As per preliminary report, they were sleeping on the railway tracks and the goods train ran over them. 2 workers were injured in the accident.
Indian Railways has said that it has operated about 200 Shramik special trains since the 1st of this month and ferried home nearly 2 lakh migrants stranded in various parts of the country due to the coronavirus-induced lockdown. 40 such trains departed yesterday, including the first train to originate from New Delhi carrying 1,200 migrant workers to Chhatarpur in Madhya Pradesh. Railway said it ran 56 Shramik special trains on Wednesday. Every special train has 24 coaches, each with a capacity of 72 seats. But the national transporters allowing only 54 people in a coach to maintain social distancing norms by not allotting the middle berth to any passenger. Altogether, 24 Shramik special trains from 7 states carrying 28,427 stranded migrant workers, students and others reached different stations in Bihar yesterday. 17 special trains carrying 20,000 stranded workers, students and others is reaching different parts of the state. In Madhya Pradesh, Gwalior Police has started an initiative to encourage women of self-help groups as well as to teach a lesson to those who roam in the city without masks. More from our correspondent.
The police is charging 100 rupees as a fine from the people who are driving without the mask, but in return also giving them 10 pieces of cotton mask. Gwalior SP Navneet Bhasin told AIR that the people are very much supporting this scheme.
हमारा मेन पर्पस मास्क लगवाने का है, बदले में लोगों को मास्क देते हैं तो उसका चलन उतना पड़ेगा। इसी उद्देश्य को ध्यान रखते हुए कुछ स्वयं सहायता समूह ने भी मास्क निर्मित किए थे। दोनों चीजें एक तरह जुड़ गई, उनके मास्क का विक्रय हो गया और जनता तक मास्क की पहुंच बढ़ गई।
District Panchayat CEO Shivam Verma said that women of self-help groups in Gwalior have so far produced 2 lakh masks through day and night efforts to defeat the coronavirus infection. Gwalior is probably the the first city in the state and the country to take this unique initiative to provide mask in lieu of punishment. With Naveen Srivastav from Gwalior, Sanjeev Sharma, AII News, Bhopal.
In Mizoram, villages, councils functioning in the rural areas of the state are playing a pivotal role for the welfare of the people, especially during the COVID-19 pandemic. These village councils are the main machinery that are monitoring that people keep social distancing and help people in this difficult time. Our correspondent has filed this report.
Longklai village councils are strictly maintaining the lockdown guidelines with its village level task force volunteers working round the clock. Secretary of Longklai Village Council, Mr. Lalthang Zwala, said that Village Council Task Force closely monitors the movement of the public. People comprising commons, shopkeepers and vehicle drivers who do not wear face masks when going out are charged with a fine of 100 rupees.
Under the chairmanship of the village council president, village level task force still functions to solve the problem. People who do not have food to eat, they distribute their family from the contribution of the village people and from the government.
By the supervision of village council, so far 10,633 families of Longklai have received free food grains under Pradhan Mantri Garib Kalyan Yojana. With Lalneta, Irene from Aizawl.
In our series Experts Speak on All India Radio, we bring you the views of leading medical experts on COVID-19. Dr. Nand Kumar, Professor of Psychiatry, AIIMS, suggested people to stay at home, spend time with family members and practice yoga.
We are going to overcome this crisis within a few weeks. In the coming few weeks, stay at home, spend time with the family, do household work, exercise, listen to music, sing with the family, do yoga, meditation, and take care of emotional need of the family and yourself.
Dr. Anvita Agarwal, resident infectious diseases AIIMS, advised people not to be negligent and stay at their homes.
Coronavirus may be invisible, but the number of people affected are very much visible. More than 4 lakh people have already been affected all over the world, and the numbers are increasing from day to day. Don't be negligent. Please stay at home.
Senior physician at GB Pant Hospital in New Delhi, Dr. Sanjay Pandey has said that India is in a far better position compared to other countries as far as COVID-19 situation is concerned.
अगर हम यूएस से कंपैरिजन करते हैं या यूरोपियन कंट्री से करते हैं या चाइना से करते हैं तो कॉम्प्लिकेशन और मोर्टेलिटी काफी कम है और यह सबसे राहत देने वाली बात है। ये दिखाती है कि अगर कोरोना का संक्रमण हो भी जाता है तो उसमें पैनिक होने की कोई आवश्यकता नहीं है। पास के जो भी अस्पताल है वहां मिले, जांच कराएं और जांच कराने पे अगर कोरोना आता भी है तो इसमें कोई पैनिक और बहुत ज्यादा घबराने की बात नहीं है। हाँ, अगर आपकी उम्र 60 से ज्यादा है या आपको पहले से हाइपरटेंशन, डायबिटीज या कोई और कोमॉर्बिड कंडीशन है तो आपको थोड़ा सा सतर्क रहने की जरूरत है।
The News Services Division of All India Radio in its bilingual live phone-in program today will bring you a special discussion on COVID-19. Vaidya Rajesh Kotecha, Secretary, Minister of Ayush, will participate in the discussion. Listeners can ask questions to the expert on toll-free telephone numbers 1-800-115-767. Repeat, 1-800-115-767. You can also ask questions on telephone number 011-2331-4444. I repeat, 011-2331-4444. And post queries on our Twitter handle at AIR News Alerts by hashtag AskAir. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards. This program will also be available on our website newsonair.com and on our YouTube channel News On Air Official. You can also follow us on the News On Air app for updates.
The total number of coronavirus COVID-19 cases across 187 nations reached 38,97,525 and the death toll stood at 2,69,487 tonight. With the highest numbers, both in positive cases and death toll, the U.S. continues to remain the worst hit with a total of 12,86,524 cases. It is followed by Spain with 2,56,855 cases, Italy with 21,05,858 cases and the UK with 2,06,715 cases and Russia with 1,77,160 cases.
Prime Minister Narendra Modi had a conversation with President of the European Council, Charles Michel, over phone yesterday. The two leaders discussed the COVID-19 pandemic situation in India and the European Union and responses to it. They appreciated mutual cooperation extended in the face of the pandemic, including for ensuring supplies of essential pharmaceutical products. The leaders recognized the importance of regional and global coordination to effectively address the health and economic impact of COVID-19. The leaders reaffirmed their commitment to strengthening the India-EU strategic partnership. In a series of tweets, Mr. Modi said, India-EU partnership has tremendous potential in many areas, including scientific research and innovation. The Defence Research and Development Organization's DRDO has installed its ultraviolet disinfection chamber at the Cochin International Airport in Kerala. On April 7, the DRDO had deployed a disinfectant chamber at the All India Institute of Medical Sciences in the national capital to prevent the spread of coronavirus. DRDO officials said that the chamber uses a solution that is known to kill COVID-19 and will help in controlling the spread of coronavirus in the country.
Human Resource Development Minister Ramesh Pokhriyal Nishank has announced that the joint entrance examination JEE Advanced will be held on the 23rd of August. JEE Advanced is an entrance exam for admission to IITs. The crucial exam was scheduled to be held on the 17th of this month but was deferred due to the coronavirus lockdown. Mr. Nishank said the JEE Mains will be held from the 18th to the 23rd of July. JEE Mains is conducted for admission to engineering colleges across the country and is considered as a qualifying exam for JEE Advanced. The top 2.5 lakh candidates who are successful in JEE Main exam are eligible to appear for JEE Advanced exam. The HRD Ministry's National Testing Agency, NTA, had also given students an option to change their opted centres for the two tests, as many of them have moved to different places during the lockdown. However, National Eligibility Cum Entrance Test, NEET, will be held on the 26th of July. Earlier this month, the Union Public Service Commission, UPSC, deferred the Civil Services Preliminary Examination 2020, scheduled to be held on the 31st of May due to the lockdown. The new date for the test will be decided later this month.
Now, an overview of today's newspapers covering COVID-19 stories. India locked out, Bharat offers recovery hope, headlines Business Standard. Rural India, less affected by COVID pandemic, has been blessed with a record produce of Rabi crops, says the report. Ayush Ministry and other ministries have found hands to test the efficacy of herbal-based medicines like Ashwagandha, Yashti Madhu on COVID-19, reports the Pioneer. ICMR has declined Jal Shakti Ministry's proposal to test Holy Ganga water for COVID cure, citing requirement of more scientific data, says the Statesman. Now, Author Road Jail in Mumbai has 77 inmates and 26 officials testing corona positive, is a story in Times of India. There has been 60% rise in calls by women subjected to domestic violence in Europe due to COVID lockdown, reports The Hindu. And finally, Mail Today reports of babies born in the last few days being named as lockdown, sanitizer and corona for a baby girl.
And now, before we end this special news program on COVID-19, the headlines once again. Centre offers all help to Andhra Pradesh to tackle situation arising out of Visakhapatnam gas leak. Home Ministry issues advisory in the wake of the incident. Health Minister Harshvardhan says no corona positive case reported from 13 states and union territories during the past 24 hours. 2 Air India flights bring back over 360 Indian expatriates from the UAE. Health Ministry issues guidelines for quarantine at private hotels, service apartments and lodges. And about 200 Shramik special trains ferry nearly 2 lakh stranded migrant workers and students back home. And with that, we end the special news program on COVID-19.